And of course, this is very, very important, what is written there, the need of a strategy, or if not the need of a strategy, but the strategy itself has to be legislated. This is the best insurance for any action plans you can have, legislative frame. Let's see the concrete things. Let's see the schedule of the actions taken during the development of the strategy. If you look at the table, you can see that it took quite a time for us to reach the final success, which happened in January 2010, when finally the Hungarian government adopted a governmental decree on the National Autism Strategy. But if you look at the details, you can also see that it took, it took 7 months to develop the strategy itself. So lobbying is very time-consuming, and planning is also, and setting up the strategy or an action plan is also time-consuming, but 6 or 7 months is just not that much, I think. Yes, when you try to cope with a group of people, a group of experts, there can be awful and unbearable things happen, because people just don't like each other. Stakeholders are not very cooperative, and I can assure you that during the development of the strategy, there were people, very well-known professionals, crying during the working group. There were shoutings, there were quarrels. It wasn't a very nice period, but finally we achieved a phase where we developed a document which was agreed by all the stakeholders, and which was assigned by all the stakeholders. You have to include all the groups who have interest in this case. You have to include professionals, because if you don't use evidence-based methods or treatments, then whatever you describe and whatever you suggest for your government will just won't work, because we are talking about science, and autism needs profound knowledge. So you have to include highly qualified professionals. You also have to include parents, because they are the ones who are standing for their children. Nothing about us without us, that's true. You also have to include experts, because even if there are professionals who are highly qualified in autism and they are working in a school or in a social service, they are not the experts of the running of the service. A school principal knows it better how to run a school than a professional who teaches in the classroom. And I think this is the most important thing, because I don't know how many of you are working in ministry or in public administration, but I think not many of you. And I think this can be a huge mistake to make, not to include in such a work civil servants of ministries. Because I don't know whether you agree with me or not, but I'm sorry, public administration is a profession. It's a profession. It's just equally important with autism, with sciences. And after all, the document you are going to develop, such an action plan or schedule or strategy, will be used by the government, so it has to be developed in a language which is familiar for public administration. Let's go into details. Let's see, what is the strategy itself? Well, it's not that big deal. It's a document. It's just that thin. It's 32 pages. It has 9 chapters, our strategy, plus appendix, plus some financial analysis which were done by us, and later on they were revised by the Ministry of Social Affairs. You can, if you look at the content of the table of contents, then you can see that there are certain chapters which are targeting certain areas, such as the assessment of the current services, which is very important. We don't have a profound knowledge of the quality of services. We have experience in it, but we don't have a well-detailed, profound knowledge. But then there are chapters following each other, which are pretty close to the lifespan. I mean, professional screening and diagnosis at the early age, then early development and educational services, adult training or adult education, and then employment and family support. We included basic things in the appendix because I think it's just not useful to put everything, to stuff everything into the main document. So we put the definition and prevalence of ASD and the legal frames given by either the Hungarian state or the European Union. So we put all these things into the appendix. Within each chapter, and now we are going to details, within each chapter, you can find a short description of present situation, and I mean by short description, a short description, so it means 7 lines or 8 line tops, not more. Nobody needs long pages of sorrow and problems and bad picture. Then a very concrete, very targeted suggestion for concrete programs, and then an estimated cost and deadlines suggested. Of course, the more precise estimation has to be done by the ministry always, but they have to see something which is approximate to the expected costs. And I took a sample. I chose the chapter which I call the health chapter, but it's not about health services, but more about screening and diagnosis. And you can see that within this chapter you see 4 sub-chapters. Improving early screening and diagnosis, this is the very early age. Improving the diagnostic system for children, this is about diagnosis. Then the diagnosis of adults. And finally, the transition between child and adult psychiatric services. We are going even deeper. I chose improving the diagnostic system for children. You see, it's the first dot in this chapter. No, it's the second one, sorry. Improving the diagnostic system for children have 3 parts. One describes the possible goals, one the tasks to be done, and one the requirements. These can be, in this case, there are both costs of the programs, and there is also one short part about the legislation of this, because in the national health insurance system there must be legislative changings made if we try to execute this program. What we suggested to the government, this is the main thing, so when you think in terms of schedule plan, this is what it is. We suggest that there must be 20 professionals. It's such a small number. 20 professionals trained for using standard diagnostic tools. They must be given test equipment. Follow-up trainings must be provided, and there would also be somebody to supervise them. Why the number is so low? Because we know that financially it can be very challenging to work with huge numbers, and we thought that our government, will find a small number and small costs more attractive. And this is something to be done, this task, and it was written 2 years ago, in 2 or 3 years. So with such a number, governments can work. Yeah, I'm reaching the end soon. And the results of our national autism strategy since 2009, there were certain programs launched, which is very important, and I haven't mentioned yet, is the Autism Strategy Working Group, which is a working group of professionals and also civil servants. This is, we call it the engine of the strategy, because the strategy won't execute itself, and we don't want only civil servants to work on the strategy, so we needed a group of experts. They are not employees, they are not constantly paid workers, but they are hired professionals, and this gives quite a lot of flexibility for the program. And finally, for conclusion, we could say the work is done, because now I'm standing here and talking about the National Autism Strategy of Hungary as an international good practice, and you could think that everything is perfect now in Hungary and this is really a good practice, but it's not true. I'm sorry. The work is not done yet. If you want the government to work with such an action plan, you have to keep on lobbying, you have to always be there, you have to contact member of parliaments, you have to contact civil servants working in ministries, and it really needs time and an awful lot of work. And of course, the strategy is not perfect. After 1 year, we realized that there are so many mistakes in it, so we are planning an updating of the strategy in the following year. I thank you now for your attention. Just a few final words as conclusion. Such a strategy or action plan is not exceptional. There are certain things which are quite similar to this all around in Europe. There is Great Britain, they have their Autism Act and Autism Plan. It's an only England Autism Act, but they did quite the same. There is also European Disability Forum, which with a great lobbying achieved the European Disability Action Plan, which was run between 2003 and 2010. So there are other examples for this approach, for this framed approach of lobbying for better services. It's not the magic wand of Harry Potter. It won't make things change instantly. It's not a book. It's real life. And maybe in the discussion I can also go into details if you have questions. Just one other thing, and now I ask my colleagues to spread the sheets, that one of the benefits of the autism strategy was that during the work, NGOs and professionals and stakeholders were cooperating with each other, and this meant a better and more intense cooperation. And by that cooperation, I think there is a movement now in Hungary which made us stronger, and this strength gave us the chance to apply for the opportunity to give place for the next Congress of Autism Europe, and I'm very happy to invite you all to Budapest in 2013, where we meet. Thank you.